I'm Neil Smith. I'm a GP, I'm a Macmillan GP, and I'm Cancer Care Lead in Pennine, Lancashire. What I'm trying to do is to support GPs and other healthcare professionals in helping patients with cancer. Cancer is something that touches all our lives. A third of us will get it, and over a quarter of us will die of it. The incidence of cancer continues to grow. Cancer is now the commonest cause of premature mortality in our country, higher even than the combined figures for both ischemic heart disease and cerebral vascular disease. It's estimated that in the next decade there'll be 4 million cancer survivors living in our community. In Britain, cancer care outcomes are poor compared to the rest of Europe and other countries with similar health economies. There's tremendous variation across the country, with differences between localities and even neighbouring practices. Cancer is what patients fear the most and what GPs fear of missing in patients. Historically, I believe that primary care has been disenfranchised with its involvement in cancer care. It's been seen as the responsibility of public health or the sole remit of the oncology services. In my career, I've seen considerable developments in end-of-life care for cancer sufferers, but not necessarily the same improvements in other avenues of cancer care. Cancer is not one disease, but a plethora of pathologies, each with their own challenges. Every patient journey is quite unique. Cancer involves a range of themes: prevention, screening, public awareness, primary care responsiveness, and then moving on to diagnostics, referrals and treatment, ultimately either recovery and survivorship or end-of-life care. In the last few years, GPs have become far more involved in cancer care, particularly with better access to diagnostics and in the introduction of the 2-week wait referral systems. What we can be certain of is that the later the stage that the cancer is diagnosed, the worse the prognosis. Those cancers diagnosed as an emergency presentation have far worse outcomes than managed diagnosis, for example those picked up through screening and those diagnosed following a GP referral. Early diagnosis really does save lives. What I believe we're about to experience is a wave of new initiatives aimed at empowering primary care in cancer improvements. These are likely to improve, amongst other things, even better access to diagnostics, an update in the 2-week referral pathways, and the availability of cancer risk assessment tools for general practitioners. What is essential is better education, and for the last 2 years I've been developing and delivering a cancer care course for GPs. This has been in unison with the Royal College of General Practitioners and my local cancer care network. What you're about to witness is an initiative that this course has spawned. In this Talking Head project, we're trying to capture some main themes and share with a wider audience. I've defined the 4 common cancers: lung, breast, prostate and bowel, and added in the new initiative of an acute oncology service. You're about to see me interview the consultants and specialists in these areas that are speakers on the course. I've analysed the feedback from my colleagues who attended the course and picked out 4 key questions which a GP would say was essential if they had the opportunity to speak to these experts. I've tried to make it relevant and applicable to any GP, and I hope it can make a difference for your patients.